1. You're now live.
Hello everybody, happy Thursday Thoughts with Dr. Wegerif here at Pure Plastic Surgery. So a few things. First of all, I want to say my Instagram account is having some technical difficulties right now, so we're addressing that and it should hopefully be back online in the next day or two. Second, it's Hispanic Heritage Month, and so I want to say thank you to all of my Hispanic patients and the contributions that they have to our society, and thank you, we support you. And then we're going to get into a few new topics today to discuss. Earlier today in this room, I had a mommy makeover for a beautiful patient. She had a mastopexy without augmentation and also a drainless tummy tuck. And whenever we do a mommy makeover or we offer any type of surgical intervention for our patients, topics that I need to cover with our patients is what procedures we can combine and do together at the same time. And this is limited partially by surgeon preference and then also by some rules dictated by the state of Florida. And so I want to get into a little bit about what we can do and what I personally view as safe things to do together versus procedures that we kind of need to break up and do at separate times or in a staged approach. And so let's first start with some restrictions that the state of Florida has on plastic surgeons. So one of the things is we have a total limit to the amount of liposuction we can do at any one time. And that's for a patient that's getting liposuction without any other cutting procedure. So breast augmentation, abdominoplasty, brachioplasty, anything like that. If it's just doing liposuction and fat grafting, the limit is 4 liters of super net fat. So that means 4 liters of actual fat that we remove from the patient. And so that's a strict limit enforced by the state of Florida that I follow. Other states don't have that limit, and so other places sometimes do a little bit more, but there also becomes a question of what's safe to do in an ambulatory surgery center like we have here at Pure Plastic Surgery. If you're gonna do a lot more than that, you should really be admitted to a hospital because there's a chance you could have fluid imbalances after removing much more than 4 liters of super net fat. So here at Pure Plastic Surgery, our limit is 4, that's what I stick with. And then another rule that the state of Florida has for liposuction is when we're doing it in combination with a cutting procedure. So like the mommy makeover I did today, we did liposuction, we did some liposuction of the arms, we did some liposuction of the flanks, but we're limited to only 1 liter of super net fat whenever we're doing cutting procedures in combination. And so for most of our patients that's getting an abdominoplasty, that's plenty. We're not gonna be taking off more than 1 liter of fat from your flanks to give you that hourglass shape, but we can't do all of it. And we get a lot of patients that's coming in, you know, they wanna get their back, their flanks, their front, they wanna get everything. So we're limited in the state of Florida, and again, rule I follow. Now let's get into some of the things that are surgeon preference in terms of combination procedures. So often when we talk about a mommy makeover, this is any type of surgery for the breast and the belly, and I think that's fine to do those together. If you're conservative and you want to break it up just because you're concerned about the recovery or something like that, we're happy to break it up over 2 different surgeries, but people do really well with that, and as long as we're not going over 5 or 6 hours in the operating room, it's safe to do those combination procedures. We can always add in little things like maybe liposuction of the arms that we did today, and then even possibly a brachioplasty if it's not an extensive one, or an arm tuck. Some of the things I don't really do at the same time that some other plastic surgeons do, to each their own, but personally just for the sake of safety and getting the best results, I don't like to combine doing BBLs and abdominoplasty. And again, that becomes a little bit of a difficult thing to do in the state of Florida because of those rules that they have, but also from just a technical standpoint, we got to think about the recovery that you're going to have from each of these procedures. And so an abdominoplasty, where we're taking out all the loose skin and fat from your lower abdomen, I'm going to have you hunched over and pulled real tight for the first few days after surgery, and you have to sit in a recumbent position to recover from that surgery. And then if we're doing a BBL, everybody knows you got to stay off that freshly grafted fat so that it can establish a new blood supply and survive. And so Some surgeons say that you can prop up with pillows underneath the legs and the back and suspend the butt and still sit in that recumbent position. That seems incredibly hard for a patient to do for those, full multiple weeks after surgery to get the best result. And that, my thought is just, you're not going to be able to do that long term. You're going to end up putting too much pressure on your fresh BBL. The maximum amount of fat graft is not going to be able to survive. You're going to get a suboptimal result from the butt, maybe even the belly from just, not being able to tolerate being in that position for a long time. So I break those up. Other surgeons have different preferences about that. I believe all of our surgeons here at Pure Plastic Surgery agree that it's best to break up those procedures. But just something that I want to talk about and give you the reason why we're not able to do some of those things together. That's the main limitations that we have. Sometimes when we talk about, massive weight loss patients, they want to get their thighs done, their arms done, their belly, circumferential body lift. We have to be cognizant of how much we're doing at any one time. We want to limit the amount of anesthesia you're exposed to decrease the risk of DVT and blood clots. And so each one of those procedures is going to be tailored to what you're looking for. We can usually do 2 or 3 at a time, but we can't do everything that you may want to do, and we've got to do it in a staged approach. All right, Willie, you got any questions so far?
I have plenty.
Okay.
But first of all, do you work in patients with a high BMI?
So my BMI cutoff is 34. And again, that's a safety issue for ambulatory surgery centers. It is possible to do patients with a higher BMI, but it needs to be done in a hospital. And we typically don't do that here at Pure Plastic Surgery. So my cutoff is a BMI of 34.
Okay, how many years of experience do you have practicing, doc?
So I have a lot of years of experience. I did full general surgery, so I graduated medical school back in 2013. So this is going on my 10th year, 11th year of practice. Well, I did residency and fellowship first, and this is my 2nd year of plastic surgery practice that I'm in right now.
Can you do lipo off the brow line while getting mommy makeover?
Typically not. So most patients, again, we're focusing that amount of that 1 liter limit that we have to your flanks. And we also don't want to be doing stuff where we're causing you trauma to the back where you have to recover and lay on your back while you're recovering from the mommy makeover. So that's typically not something we do. If it's a very small area or a small amount of liposuction on the back, it's possible to consider, but I would have to do that on a case-by-case basis.
Do you perform in-person consultations here at YouTube? Ooh.
Here on YouTube, I have not, I don't know, we perform, you mean virtual consultations?
If you do in-person consultations, if you perform.
Yeah, I do in-person consultations. I love in-person consultations. I frankly would prefer that over a virtual consultation because I get to touch and feel you and see exactly what is gonna best serve you. But we can do it virtually, we can do it in person. Anyone, even if you get a virtual consultation, you're always gonna get an in-person evaluation at least the day before your surgery.
Okay. I had spinal fusion on my back. Would you do lipo on someone as such?
It depends exactly what your history is and how you recover from that, but there's a lot of patients that get spinal fusion and they recover and they do fine. Depending on the area that you need lipo, if it's truly around the area where you got your fusion, we may want to leave that area alone because one of the big risks with a spinal fusion whenever you have an implanted device is if you were to develop an infection that was to interfere with your fusion hardware, that's something we want to avoid. But if you have a fusion on your back and you want lipo of your abdomen, yeah, we can probably do that.
Can you get a tummy tuck and a butt reduction at the same time?
A tummy tuck and a butt reduction at the same time. So we're talking about a few different things here. We've gone kind of both ends of the spectrum with the BBLs, and some patients are getting BBL reductions that we're doing with just liposuction and usually an energy device like our BodyTite. Then there's other patients that, especially massive weight loss patients, they have a deflated butt and they need a butt lift, but that's not the traditional Brazilian butt lift where we're grafting fat, where we're actually excising skin, and that's called a circumferential body lift, where we can take skin from the front all the way around to the back and tighten up that skin. So we can do that. But what was the question for that? Can we do a butt reduction?
Butt reduction, yes.
If it's just lipo, we could probably do that at the same time, but I would need to evaluate you and to make that final decision.
Yes. Okay. How's the consultation process? So I mean, how they can get a consultation?
So we have on our website, pureplasticsurgery.com, one of the first things you'll see there is a form to fill out to start the process for a consultation. Again, you can do that virtually or in person. Okay. Doug, we are getting to the end of the live. All right.
So anything else to say? This one, do you resize the belly button or keep the original one during a mommy makeover?
So yes and no. Everybody keeps their original belly button. We do trim around it, and we can make it it gets smaller for most patients, but at a certain point, your belly button stop, where it's actually attached to its blood supply. We have to keep that at its normal size, but for most patients, it gets smaller. All right, everybody, have a great Thursday. See you next week.
Yes. Okay, 1 second here. Boom.